Achondroplasia diagnosis and management. Achondroplasia is a rare genetic disorder caused by a mutation in the FGFR3 gene. This disorder affects cartilage development, leading to abnormal bone growth, particularly in the limbs and skull. Signs and symptoms. Achondroplasia is characterized by the following signs. Short stature. Arms and legs are shorter than normal, especially the forearms and lower legs. Large head, prominent forehead, wide skull, and a flattened bridge of the nose. Signs and symptoms. Short hands and fingers. Fingers are short and thick, and may have a trident hand appearance. Lumbar lordosis causes a curved back and back pain. Small chest can cause breathing difficulties, especially in infants. Small lower jaw may lead to chewing and swallowing difficulties. Signs and symptoms. Narrowing of the spinal canal can cause numbness and weakness in the legs. Diagnosis. Ultrasound. Detailed ultrasound can detect structural abnormalities in the bones, such as short limbs, large head, and short hands. Facial features become more apparent in pregnancies beyond 22 weeks. Diagnosis. Genetic testing. Invasive testing like chorionic villus sampling or cell-free DNA cfDNA analysis can detect the FGFR3 gene mutation. Prenatal monitoring. Pregnant women at risk of having a child with achondroplasia should be monitored closely with ultrasounds every 4 weeks to assess fetal head growth. Delivery. Standard obstetric and delivery care is recommended. Caesarean delivery may be performed if the fetal head circumference is greater than 40 centimeters. Postnatal care. Medical management can help manage complications associated with achondroplasia, including respiratory support may require the use of ventilators or surgery to improve breathing. Orthopedic surgery may be needed to lengthen limbs, correct spinal curvature, or adjust bone abnormalities. Postnatal care. Physical therapy helps improve mobility and function. Genetic counseling. Families should receive counseling on achondroplasia and genetic options. Prognosis. Heterozygotes. Children with heterozygous achondroplasia typically have a normal life expectancy and normal intelligence. However, they may experience respiratory, musculoskeletal, and mobility issues. Prognosis. Homozygotes. Homozygous achondroplasia is rare and often results in early death due to severe pulmonary hypoplasia. Recurrence risk. Achondroplasia is an autosomal dominant disorder, meaning if one parent carries the mutated gene, their child has a 50% chance of inheriting the disorder. Note: this information is for informational purposes only. Always consult a medical professional for diagnosis and treatment. Other complications or conditions may affect the fetus. Your physician can provide additional information tailored to your specific situation.